Hello everyone. So this next section of videos is going to be primarily about muscles and how to palpate those. In all the videos, we tried to get you good angles to kind of see what was going on, but I did not put as much specific detail in as you'll need for the assignment. So please be sure on your assignment to be giving us anatomical locations, origin insertions, what you're feeling, maybe their actions and how you're feeling it. That way, whenever we're grading your assignment, we can be sure to know that you are actually feeling the structure that you're intending to, and then developing those skills so that you can be a rock star OT moving forward. Hello. I also want to bring to your attention that for each of these muscle videos, I'm showing you the position that you would put somebody in order to test their muscle strength. There are definitely different positions that a person can be in order for you to palpate the correct muscle. However, I think that for your learning, it helps to see the test position, because then you can truly feel the fibers of the muscle that you're palpating and then be able to identify whether or not you're on the correct structure. Another thing that I also want to mention is that my body position isn't always the best for my own body mechanics and ergonomics. We did that so that I could show you and try to identify the best angle for you to see what's going on. However, it's not perfect. So just be aware that in your practice and moving forward, you'll always want to be aware of your own body mechanics so that you're taking care of yourself as well. Okay, I don't know how I'm going to do this. Okay, so to test the upper trap, what I'm going to have the client do is I want them to first do the action of the muscle in order for me to palpate on it. So upper trap does a few different actions. One of it is flexing of the neck and then also elevating of the scapula. So I want you to bring your ear towards your shoulder here. Bring your shoulder up. And what that does is it's put tension right along here onto the upper trap. I'm gonna feel here, put my hand on it to palpate it, and I can feel that this muscle here is activated, and that is her upper trap. All right, so next to test the middle trapezius, the middle trap, your patient's gonna be prone with their arm into some external rotation. You're gonna palpate and feel where you know the middle trapezius is by its origin insertion. If you were to apply pressure downward onto their forearm, you'll be able to feel and palpate the muscle fibers of their middle trapezius. To test the lower trapezius muscle, you have your individual in prone with their arm up and out to the side, so into some flexion and some abduction of the arm with their arm in the neutral plane. You're gonna palpate and feel for their scapula. Put your hand on the muscles where you know the origin and insertion is. You apply downward pressure onto the arm, and in doing so, you're able to feel the muscle fibers contract on the lower trapezius muscle. For the supraspinatus, what you're gonna have to do is have your client turn their head opposite the direction of the side that you're wanting to test. They're going to extend their neck slightly to look upward and have their arm in a 90-degree position. By doing so, you're having them activate the supraspinatus muscle here that sits on the top of your scapula superior to the spine. So whenever you're palpating that, you want to make sure that you are on the correct muscle group, hands on it, and then you are also going to apply pressure downward onto their humerus bone and into external rotation. By doing so, you're able to feel that muscle contract, and you can palpate it that way. For the latissimus dorsi, your patient or client is going to be prone. Their arm is going to be extended and internally rotated so that their palm is up towards the ceiling. In doing so, they've activated their latissimus dorsi fibers. I'm going to apply pressure to the opposite direction, making them hold this position, and in doing so, while palpating them, knowing where their origin and insertion are, I'm able to feel the latissimus dorsi on your client's body. For the infraspinatus muscle, your client is going to be prone on the mat with their humerus supported by part of the mat. In doing so, it prevents the arm from going into ab or adduction, because we truly want to test the muscle, the rotation of the infraspinatus. So for this one, what you'll do is you'll palpate to find your spine of your scapula. Make sure that you are on the infraspinatus muscle, and then you will apply pressure downward in order to feel the muscle contract on their infraspinatus. For the pectoralis major, you'll have your client in supine. Their arm will be up at a 90-degree flexion with their arm medially rotated. In order to palpate the muscle fibers, you'll have to know the origin and insertion. Place the body of your hand right on that joint, primarily where most of the muscle fibers lie. And then you'll pull their arm into what's called horizontal abduction. So you'll pull their arm away from their body. You'll have them try to stay stationary, and in doing so, they'll activate their muscles. So as I pull, I can feel the muscles here and palpate the muscle fibers that are contracting. For the deltoid muscles, your middle, anterior, and posterior, each of the fibers do something slightly differently, but I'm going to show you them all in this same video. To test the middle deltoid, you'll have your patient sitting with their arm in abduction to 90 degrees. You'll place your hand on the muscle fibers where you know where the origin and insertion will go. And then you push on their humerus bone to try to bring them back into adduction while they're holding stationary. And in doing so, you're able to feel the muscle fibers contract. For anterior deltoid, their arm is still going to be in about that 90 degrees. It's just going to be forward a little bit because the anterior fibers do some flexion. So I'm going to palpate knowing where my origin and insertion are. I'm going to try to pull the humerus back while she's not moving, and in doing so, I'm able to palpate those specific muscle fibers. For the posterior deltoid, I'm going to bring her back into a little bit more of extension. I'm going to place my hand where those muscle fibers are by their origin and insertion. I'm going to push forward while she's holding stationary, and in doing so, she's activating her posterior deltoid, and I'm able to palpate that muscle. For your biceps brachii, you're going to have your patient sitting in a upright position with their arm at a 90-degree angle. Knowing the origin and insertion of the biceps brachii and the action, you're going to have them here flexed. I'm going to pull their arm into an extended position at the elbow, and I'm going to palpate right on the muscle belly, the body of that muscle. And in doing so, I'll be able to feel that muscle contract. So as I push down, she'll stay stationary, and I'm able to palpate and feel her biceps brachii. For your brachioradialis, again, you'll have your patient sitting in an upright position with their arm and their elbow bent at 90 degrees. Their forearm is going to be in a neutral position because of the action of the brachioradialis. What I'm going to do is I'm going to apply pressure so that I can see their arm into extension while she's holding stationary. And by putting my hand over the brachioradialis, I'll be able to palpate and feel the contraction. So here's the brachioradialis. As I pull down, I'm able to palpate and feel the contraction there. For the extensor tendon muscle bellies, to palpate that, first you have to find the lateral epicondyle because that's where they insert. Then I'm going to put the person into a pronated position. That way I can see those muscle bellies, making sure that I'm still orienting myself with that lateral epicondyle. I'm gonna bring their arm back into wrist extension. And in doing so, the muscle fibers here have already started to overlap in the sarcomere. I'm gonna push their arm into flexion, having them hold stationary. And as I do that, she'll be activating the extensor tendon muscle bellies. It's the big grouping of them. So I'm gonna put my arm on it to palpate. I'm gonna push forward, don't let me move you. And I can actually palpate and feel her muscles right here for the extensor tendon muscle bellies. For the flexor tendon muscle bellies, I'm gonna make sure that I'm palpating and on the medial epicondyle. I'm gonna have their arm in supination so that I can readily access and feel where the flexor muscle bellies are. I'm gonna have her arm into some wrist flexion because that's what those muscles do. I'm gonna put my hand here on her so that I can feel those muscle bellies in action. And as I pull her wrist back, she's gonna stay stationary, not letting me move her, and I'm able to feel the muscle bellies contract. All right, so for triceps brachii, there's a couple different ways that you can test it. I'm gonna have you do this by having your patient being in a supine position with their arm up in the air, so kind of at a 90-degree angle in the shoulder joint, and mostly extended here in the elbow. I'm gonna put my hand on the triceps brachii where I know the origin and insertion are and where the muscle bellies are. And what I'm gonna do is I'm gonna pull her into elbow flexion here, but have her stay stationary. So she's going to be working into elbow extension. And as she's working into elbow extension, I'm gonna be able to feel the muscle fibers at work and be able to palpate them. So I'm gonna pull into flexion, and now I can feel her triceps here and I can palpate those. For the SCM muscle, what you're gonna have them do is perform the actions of that muscle in order to palpate it. So I'm gonna have my patient here rotate her head to the opposite side of me that I want to test. She's gonna also laterally flex, so bringing her ear down towards her shoulder joint. And then she's gonna bring her head forward ever so slightly. In doing so, you can see here that her SCM attaches down here on one of the bones in your chest, and then also comes up here to the base of your skull. So in order to palpate it, I would just feel that muscle and feel the tension and its contraction. For the thenar and hypothenar eminences, to palpate those, you would know where the origin and insertion is of that primarily grouping of muscles. Right here is the thenar eminence, and I palpate it by putting my hand on it, and I'm able to feel the muscle fibers. I can have her flex her thumb in order to get a little bit more contraction if I'm needing to palpate and feel it that way. For the hypothenar eminence, I know it runs along the 5th digit here, and I can have her, if I need to palpate it in a certain direction, I can have her bring her thumb in, or excuse me, her pinky in, or even out to the side to palpate that grouping right here along her 5th metacarpal.